Have you been suffering from cold recently and wanted to know what are some of the natural and scientifically backed remedies that could actually help you? Or is it that your little one is suffering from cold recently and you want to know something safe for him or her as well? Or you want to know whether antibiotics are the right thing to give someone if they've got cold? Well, you've come to the right place, and I'll try to simplify the mysteries of cold in this quick video. And the idea is to tell you the things that actually work and the things that really don't. Before we go forward, I would like to request you to please subscribe this channel and like this video, and also press the bell icon so that you are the first person to know about videos such as these. For those who don't know me, my name is Dr. Shoaib, and I'm one of the nephrologist and internal medicine doctors at Cambridge University Hospitals. Right, so the things that you need to do when you're suffering from cold. The first thing is to stay hydrated. By drinking more water, warm lemon water or clear broth for that matter, what you're doing basically is you're allowing your body to stay properly hydrated, and that also helps with your immune system. Try to stay away from caffeine or sodas basically, because they are water stealers, and essentially they make you more thirsty and more dehydrated in a way. Do take rest and make sure you rest enough, give yourself proper sleep time, and that allows basically your body to heal itself and basically regather itself before it fights the cold. Sore throat needs to be soothed down, and using a salt water gargle is, I think, the best way. 1/4 tablespoon salt in basically a glass of water should be enough. That basically can relieve a sore or a scratchy throat very easily. Ice chips or lozenges can be used in case of children, as most of the times they are unable to do proper gargling. Saline nasal drops or sometimes over-the-counter nasal drops are useful, especially if there is nasal stuffiness. And saline nasal drops can also be used in children and infants, as they are very safe to use. Paracetamol is your best friend, especially when it comes to extreme temperatures or fevers that are associated with cold. And paracetamol can also be used in children, though you'll have to verify the exact doses that you can give to your children, and make sure that you contact your doctor with regards to that. Aspirin, on the other hand, has to be used even with more caution, especially in children, because it's associated with conditions like Ray's syndrome, where a lot of risk is associated. Also, the use of aspirin in children less than 3 is not recommended. So before using aspirin in any of your children, make sure you've discussed it with your doctor beforehand. A cool mist vaporizer or humidifier is also a must that you should keep in your homes. And what it does is basically it creates a moist environment, which basically minimizes conditions like sore throat or dryness. It's always a good idea basically in the winter period, and that helps with the cold as well. There are several over-the-counter cold medications that are available. Some of them are antihistaminics and some of them are decongestants. The idea is basically to minimize the release of histamine in your blood, and these are some chemicals which basically make you produce a lot of clear fluid or clear water, which usually comes out of your nose, eyes, if someone's suffering from cold. So the use of these medications is okay, and that's why they are available over the counter. But one has to be careful because overuse of some of them can obviously cause problems and side effects. So if you're needing more and more of these medications, it's basically a hint that you need to obviously see your doctor, and probably something better can be done. Now, the things that you don't want to take when you have cold. Number one, antibiotics. There hasn't been enough evidence that if someone has cold only, antibiotics help. So try not to take them until or unless your doctor advises you to take them. The second thing is over-the-counter cold and flu medications, if you're using them on someone or a child less than 5 years of age. So again, it's not recommended, and if a child is suffering less than 5 years of age, ideally they should be taken to a pediatrician so that they can be properly assessed before giving anything to them. There are some things which are not properly proven enough, and there is not enough evidence that they can be used or they actually help in cold. They include things like vitamin C, echinacea, and zinc. There you go. So these are some of the tips that you can use right now that actually help with your cold. If you like this content, please subscribe this channel and also press the bell icon so that you're the first person to know about videos such as these. And also leave any comments if you've got any questions. Until next time, take care of yourself and your family. Allah Hafiz.